dear organization committee, ladies and gentlemen, dear colleagues. I'm very honored, thankful, and proud to be invited and getting the chance to present my research results here. In the beginning, I would like to introduce myself. Sorry, where can I make it larger? This, I can't see them very well. It's better now. I'm living and coming from Austria, which is located in the center of Europe. Perhaps you know the famous musician Wolfgang Amadeus Mozart, or also the Lipizzaner's famous horses. And there I'm living and working in the south, in the green region Carinthia, with its main city Klagenfurt, which is also located on a famous lake, the Wörthersee. And in this main city, there is also the main hospital. They are called Klinikum Klagenfurt am Wörthersee, which I'm working for since 37 years as a registered nurse. I'm not a doctor. And there I'm working just for 15 years in ICU and for 22 years in anesthesia care. And in alliance with my professional commitment, I studied pedagogy and finished a master course in adult education. And so I fulfilled the role as an instructor nurse as well in the ICU as in anesthesia care. And this hospital, which I'm working for, is offering nearly all specialties, all medical specialties except transplantation surgery. And 3 years ago, I became a self-employer with a colleague of mine, where we founded Care Professionals, and there we offer anesthesia-related topics in regularly time rhythms of 4 months. And last year, I published a book to this, and with the same title, but I have to translate it in English. At the moment, it's only in German. And now I would like to give a short overview of the wide range skills you need to have to be able to cover the field. And nurse anesthetist or anesthesia nurses, as we are in Austria, work in the field in the preoperative area, in the intraoperative area and postoperative area. In the preoperative area, we have to assess the patient before start of anesthesia, to get a care history, and to be able to make an optimal individual risk management. And for the intraoperative area, you should need skills like the ability to make a continuous guidance of anesthesia. You should know about the equipment if there are problems occur. You have to have an in-depth knowledge of pharmacology to be able to prepare, to applicate, and to adapt anesthesiological drugs. You should be able to interpret the parameters you receive from the diverse monitorings. You should also be able to make life-saving measurements, and also you should be able to excrete anesthesia, for example. And in the postoperative area, you also should have the in-depth knowledge of pharmacology, and you should be able to recognize immediately post-operative complications, and you should be able to handle them. I don't know, sir. Then why I started this project. On the one hand, it was my personal feeling to be used as an everyday tool without any appreciation. Then I began to ask my colleagues, because I wanted to know if I'm over empathetic about or over sensitive for this topic. And I found out that they were thinking the same way. And on the other hand, there was the increasing workload with restrictive staffing plans. As a result of this fact, there was an increased delegation observable on part of the physicians. And the thing which is really very frustrating is our legal framework, because we are not allowed to do anything on our own in the interoperative part, especially. And then there were considerations on the future development of acute care in hospitals. Package of measures. I did this research in Austria, and these measures are only for Austria. And what should be done? It would be necessary to enhance the professional profile anesthesia nursing by implementing an university level education program with 4 semesters and with standardized training, and with recertification every 2 years, for example. And what I didn't write there, it should be an education only with one curriculum. Status quo in Austria is that every single school is teaching her own curriculum, and this is not a sign of professionalization. Then a comprehensive exposition of competencies and the assumption of personal responsibility, appropriate financial compensation, and the adapted legal framework for the newly implemented professional profile. And the research I did was an exploratory one, because no one did a research in this way before. And I decided to use a quantitative method by using a questionnaire. And when I was doing this research, we were 2,000 nurse anesthetists or anesthesia nurses in Austria. And I received 376 questionnaires, approximately 15% of all of them. And I focused on the representativeness of this questionnaire by asking all groups of age, gender, and all types of hospitals and all federal states in Austria. In Austria, we have 9 federal states. And I have to say that at the very beginning, I just was sad or frustrated, because I sent my my questionnaire and the abstracts to each directions of the hospitals, and I was strictly forbidden, really strictly forbidden, to use this questionnaire in Niederösterreich, which is the largest federal state of Austria, and also in Tyrol and in Vienna. And therefore I was forced to implement an online survey in order to be able to reach at least these 8 and these 6 colleagues in Burgenland and Niederösterreich. And also Carinthia is a little bit underrepresented, but this depends on the fact that I did the same research 4 months ago in Carinthia, and there I didn't use an online survey, only questionnaires, and I didn't want to mix these 2 tools. And the next, I was interested in the gender balance. Care still is female, but in specialties like emergency departments or ICUs, or also in anesthesia, as we can see on this slide, there are more male colleagues. Approximately 1/3 are male and 2/3 is female. With this slide, I wanted to figure out how many or I wanted to find out if there are more elder colleagues or younger ones in working in anesthesia care, because it becomes easier and easier in Austria to make your career on an intensive anesthesia care after finishing your basic education, or immediately after finishing your basic education. And there you can see that there is always coming another picture, and then I don't see my slides. You can see the green bar and the orange bar are the younger colleagues in the age between 19 to 40 years, and the 41 to older, they are outnumbered. And then I wanted to know from my colleagues if they began immediately after their basic education, and 119 answered with yes, they did their basic education and began immediately to work in anesthesia care. And 218 said no, we were experienced in other stations first before we switched in anesthesia care. Then I wanted to know if there is a connex between ICU experience and anesthesia care. And advantage for anesthesia care. I wanted to know if colleagues, they think that anesthesia, ICU experience is an advantage before beginning work in anesthesia care. And nearly 2/3 of them, the green and the orange one, the green one agreed, the orange one rather agreed, and they said, yes, ICU experience first is an advantage before you switch into anesthesia care. Then I wanted to know if the doctors make delegations to my colleagues. And this is also overwhelming, this result, because the green and the orange bar agreed, rather agreed, and the red one rather disagreed, and 8-1 disagreed, and 2 didn't answer. And then I was curious because I wanted to know if these delegations are also executed by the colleagues. And there you can see that more than 75% answered with yes, which makes me say that it is really urgent, or it's important to do or to execute these delegations in order to be able to manage the increasing workload in our hospitals. And there you have to know we have no suitable legal framework. We do things we are normally not allowed by law. And the physician can say, yes, I think she or her is able to fulfill my, or to execute my delegation. And this should be changed. And then I wanted to know from my colleagues if they would like to have more experience. And there were also most of them saying, yes, we would like to have more experience. And so this is the wrong one, sorry. And with the job satisfaction, it was also interesting for me if my colleagues are satisfied with their job. And yes, they are very satisfied with their job. You can see the green one agreed, the orange bar rather agreed. And I think that depends on the fact that you are you can organize your work on your own. You don't have a direct chief who is telling you you have this or that in 5 or 10 minutes. The only thing you have to do is to work together with the doctor, with all for everything which depends with the patient, but all the other things you can manage on your own. The most important thing is if you are ready with your work, everything must be okay so that the next colleague can begin to work with your. And I wanted to know if the colleagues would like to have a change of job title. Why? Because in German, we don't have a suitable term who is able to describe what we are doing in the intraoperative setting, for example. And we have the term Pflege, and Pflege describes really everything, car washing, everything which you can clean, you can wash, this is Pflege. And therefore I was asking them, and this question divided them because nearly 50% said yes, we would like to change. The other 50 said no. And then I was asking them, if you want to change job title, give me solutions. How could we name our job? But I didn't receive anything. And I also wanted to know if my colleagues wanted an adequate education, if they have more competencies. This question I chose because I often got the accusation from doctors. What do you want? You only want to play doctors and you don't want to learn. And as you can see, the colleagues don't think that way because the majority said yes, or rather agreed, we would like to learn in case of more competencies. And there also, I wanted also to know if the colleagues are willing to be responsible for their actions or what they're doing. Because doctors also said, no, you don't want to be responsible. Responsible are only, I am only responsible. You are not responsible. And therefore I asked my colleagues, and as you see, the group who said yes to self-responsibility in case of more competences also wanted to have an adequate education in case of more competences. And even in the group who said no to self-responsibility in more competences, that majority of this group is also willing to have adequate education in case of more competences. Then I wanted to know if there is a connection between age and the wish to have more medical authorizations, because I thought the elder one, maybe they don't not be interested in having more medical authorizations, but I failed because, as you can see, I have 4 age groups: 19 to 30, 31 to 40, 41 to 50, and 51 and elder. And in each group, those who agreed or rather agreed are the largest group. They are in all groups. They are willing to have more medical authorizations. And ICU experience and adequate education. If I wanted also to know if there is a connection between ICU experience and adequate education. And the group who agreed to ICU experience as an advantage and or to have ICU experience before working in anesthesia, they also wanted to have an adequate education. And the group who rather agreed to have ICU experience first, they also, the most of them, wanted to have an adequate education. Even in the group who rather disagreed to ICU experience, even there, the most of them want to have adequate education if they're working in anesthesia care. And even in this group who disagreed with ICU experience, the major part of them also want to have adequate education for anesthesia care. And then there was the question to my colleagues if they want to have an adequate knowledge transfer if they are doing an education at master's level. This question I also chose because a doctor said, you don't want to learn, you only want to have a title. And therefore I chose this question. And the group who agreed to have a longer education at master's level or graduation, the most of them also want to have an adequate knowledge transfer. They want to have this knowledge which is necessary to handle the patient during anesthesia. And the group who rather agreed to a master level education, there is also the majority of them who want to have the adequate knowledge transfer. And there are the other groups, they are not so large. And then I wanted to know if it depends on the type of hospital, how colleagues are thinking about education. But it doesn't matter. Uniclinics, hospitals like mine, the part of my colleagues, the green and the orange bar, agreed or rather agreed to have an adequate education. In case of an increase in the job description with an extension of competencies, I'm in favor of extending the area of responsibility on the part of the law. And there, my colleagues answered with nearly 80%, because the green and the orange part of the circle answered with yes. And the next question, it was very interesting for me if there is a difference between gender in view of extended competencies. The red bars are the female and the green line is the male. And the female, you can see that 50%, approximately 50% of the female colleagues agreed or rather agreed with extended competencies, and nearly 50% of the female rather disagreed. The 65 and 47, they voted yes, we would like to have more extended competencies. Then I would be sure if the elder one are also interested in having a profound education. And as you see, I have here two groups, the 19 to 40 years old and the elder one over 40 years old. And in both groups are those who want a profound education are in the majority. And then there was the question about an association which could raise the profile of the profession, because in Austria we only have one association, the ÖGKV, but this ÖGKV is working only voluntarily. There is only one person who is working professional and all the others are voluntarily. And for anesthesia in special, there is nothing in Austria. And as you can see, yeah, the most, at least 80% are said yes. And I would like to finish my presentation with Victor Hugo. The future has many names. For the weak, it is the unattainable. For the fearful, it is the unknown. For the brave, it's the opportunity. Thank you very much.